recently there has been commotion when some investigators demonstrated that they were able to train ChatGPT to pass licensing exams. The first one is the US medical licensing exam, and since then, it has passed almost every standardized test that are currently being used to evaluate students. What we are concerned with is the fact that the data that is being used to train large language models is biased. The content in the internet is dominated with content coming from well-funded institutions from rich countries. And that is particularly true for medical content. And we are afraid that the output of large language models would reflect the bias. And that if you ask a question, and if you're coming from Brazil or Uganda, the answer that you will get from large language models such as ChatGPT may not be applicable to you. We are not discounting the power of these technologies. These technologies will for sure be a part of how we teach, how we learn. But I think we need to focus on improving the data input that we are training these large language models on. We have to make sure that there's representation, especially in countries that are disproportionately burdened by disease. Can we improve the data input of not just large language models, but also artificial intelligence in general? And one of the concrete recommendations that we have discussed in previous papers is diversifying the people who are sitting at the table. And that means we need more investigators coming from parts of the world that are disproportionately burdened by disease. We need more scientists from low and middle income countries because they understand health and disease better than the investigators who are from ivory tower institutions. We are also recommending to bring in and recruit more social scientists and work with the machine learning community, because the social scientists are experts in understanding the disparities and the bias that exist. And they may be able to help us address and guarantee that the algorithms that we are developing will not perpetuate or even magnify the inequities that we're seeing now. I think those are two very explicit recommendations that we're giving to the community, but they are easier said than done. This would mean that we would have to overhaul systems that create and validate knowledge, and there will be a lot of pushback about that. We have to improve how we teach medicine or even other disciplines, because knowledge is being taught as something that is static, when in fact there is no such thing as permanent ground truth. The learners have to be aware that ground truth is continuously shifting. They also need to be aware of how the knowledge system has been put together. They have to be aware of the gaps and the uncertainties in the knowledge system and the impact of those gaps and uncertainties in applying that knowledge itself. Unfortunately, that is not happening anywhere in any of the disciplines. We are being fed to ingest, digest a body of knowledge. We do not really understand how that body of knowledge came about and what are the limitations, what are the biases in that body of knowledge. To us, there is a need to democratize the creation and the validation of knowledge. This should not be in the sole control of a few academics who may not be able to fully understand the context of health and disease from different lenses. And we think that this has been one of the contributors why we're seeing a lot of suboptimal outcomes, is that there are very few people sitting on the table. And by diversifying those people, by bringing in people who understand health and disease better, then I would think that we are finally going to move the needle. I've had some pushback. People ask, how can you tell us that this will work? Because there will be a lot, it will require a lot of energy and even cost to revamp the system. What are the guarantees that it's going to work? Well, I don't have any guarantee, but I also know that continuing the way we do things, continuing the current system, is not miraculously going to produce a different result. We keep saying every system produces the results that it gets. And unless we change that system, we're going to come up with the same problems that we've seen over the last century, really.